Hey, everybody. Thank you so much for taking some time out of your day today to sit through our Script 2017-071 webinar. My name is Blake Head, and I'm the Senior Vice President of Product and Strategy here at Isalis, and I'm joined by my colleague, Carly Kakasula, who is the Manager of Product Compliance. Today, we're going to be walking you through some of the changes that we've been working on over the last 5 or 6 months here within Isalis. So to give everyone a little bit of context before we dive right in, the healthcare industry is going through some major changes. As more and more practices become connected through their EHRs and their pharmacies and so on, the standards around that connection process are changing to make your life better and give you and your patients more options to share data electronically, reduce friction, reduce errors, things of that nature. So we've been working really hard to update our application to meet all of these standards. It's done in such a way, and I think you'll see that as we walk through the presentation today, that you shouldn't see a lot of disruption to your day-to-day workflow. A lot of the work that we've been doing is really kind of on the back end, updating formats of files, things like that, and the security and how we communicate with these organizations to keep your patient's data safe and flowing in a nice, consistent manner. However, there are a lot of things that we have changed that you may see or may want to take advantage of. For example, we now have the ability to send cancellations to the pharmacy. So if you choose to stop a medication and you don't want to have to pick up the phone and call the pharmacy and tell them you stopped that, there's now going to be an option to do that right from the patient's chart. If you want to know that a patient is picking a drug up or had their medication filled at a pharmacy, you can start to see those things. And as you've been able to do for years, you can refill prescriptions as those requests come in from the pharmacy, and that process has been changed and revamped as well. We've added a lot of other streamlined features to fix either workflow problems that have existed, bugs that may have been out there, or just areas where we thought we were able to make your life a little bit easier in that prescription process. So I'm going to turn this over to Carly and have her walk through some of these exciting features.
Thanks so much, Blake. I am super excited to finally bring all of these updates to you, our users of Office EMR. And we really, at a high level, have 3 things that we have changed when it comes to the application. We have updated our directories that we pull on a nightly basis through Surescripts. This helps us keep our pharmacy and provider data all in sync with Surescripts. We've also updated our medication history. That's how we obtain medication history on a patient, and we've added a new feature that you'll definitely want to stick around and learn how to take advantage of, that allows you to merge med history data into the EMR. And then we've also updated, as Blake mentioned, our routing or our new prescription refills and some newer message type information from in Office EMR. So now that we know high level what we've updated, let's take a little bit more of a deep dive. With regards to the Surescripts directories, for the most part, you're only accessing this information when you are selecting the patient's pharmacy. One of the exciting updates that any of our controlled substance prescribers will be excited to hear about is that we are now getting a specialty level for our pharmacies as to whether or not they support the digital signature when it comes to our EPCS scripts. So in the past, we had been using our own flag as to whether we send a digital signature on a controlled substance script or not. And basically, as we were having failures in production, we would flip that switch. You should no longer be experiencing failures for controlled substances, as we're now looking at the pharmacy information we get from Surescripts to determine whether we send an SI flag or a digital signature on those controlled substance medications. So that should be a huge win for our EPCS prescribers out there, and I just wanted to let everyone know about that. The next thing I wanted to walk you through is our medication history updates. So as a lot of you are probably aware, when you go to our medications portal inside the EMR and click on the history button, you have the RX Hub history button here. So when I click on this, it's going to work similar to how it does today. It's going out to Surescripts. It's sending the patient's eligibility information, and we're going to go pull down any pharmacy fill information as well as payer information that we can get from Surescripts. That then displays here in the lower section of the screen. If you are familiar with the screen, you'll notice it looks just a little bit different. And we have now added the ability for you to merge any of these medications that come back on the med history into the patient's chart. And we've taken our medication reconciliation process that probably a lot of you are familiar with on this summary screen, and we've kind of replicated it here in this med history. So if you were to come through here and find medications that you don't have in the patient's chart that you want to make sure you've got so you know what they're taking, we're just going to click on the ignore button here. It's going to toggle between ignore and add. So by default, we're not going to add anything. And if you want to add anything, you just come in here and toggle to add. And then we're just going to come and select this merge button here at the bottom. That will then go add all of those selected medications to the med history. As you see, they're now there. And these will get logged as historical or patient reported medications. So this is a huge win for our customers. We hope that you all take advantage of this, but this is something we've been hearing about for quite some time, and we're excited to bring this new feature to you guys with med history. The next piece I want to talk about are new prescription updates. So for the most part, creating new prescriptions is going to look a lot like it does today. There are some visual changes to the prescription pad that I want to walk you through, as well as some requirement changes for pediatric patients. So let me go ahead and go to a pediatric patient here. Just one second, and we'll open his chart. So one change that we've made to the prescription pad is we have moved the diagnosis section. So if you recall, the diagnosis used to be down here by the pharmacy and note. It's now moved up here closer to the top. If you click on it, this will allow you to add a diagnosis code. So we're going to show you any recently used codes. You also have the ability to come in here and search by code or by description, similar to how you search for diagnoses throughout Office EMR, and select it. Right now, you have the ability to add a lot of different diagnosis codes. We can only send 2 in an electronic prescription, so you will now be limited to selecting 2 diagnosis codes per prescription. Another change is if we had or were able to pull the patient's height and weight from the last 30 days, that would now display here on the pad. We did not have any vitals on file within the last 30 days, so you'll notice it's not there. But any prescriptions for patients less than 19 years of age, they will now require a height and weight to go on the prescription. And in the event that you do not have a height and weight selected, we're going to prompt you for it when you hit the send button. So I'll show you that here in a second. Really quickly, just some other updates. We now also will send patient allergy information with the electronic prescriptions. You don't have to do anything. Just make sure as you're onboarding or intaking your patients that you make sure their allergies list is up to date, and whatever is on file when we send the prescription is what will be sent. All right, and then one other piece of information, the SIG. Right now, with the current script version, you're limited to 140 characters. This has been increased to 500. So we can now send a SIG, read the directions for the prescription, up to 500 characters. So that might be nicer for our providers who have longer directions. All right, so let's go ahead and hit the send button. And you are going to notice that here is that prompt for vitals. we will show the latest or the most recent vitals that we have on record for the patient. So if those are correct still, you can just click on that. Or if you want to create a new set of vitals, maybe this patient has grown a little bit. If they're like my son, they're in growth mode right now, you would be able to come in here and enter a new set of height and weight. And when you hit save, we're actually going to go insert that vitals record in our vitals chart tab, and then that will also go with the prescriptions. All right. So I'm just going to go ahead and hit the send button. Again, if you're using our real-time benefit checks, this process should look similar to what it does right now in production. Again, just minimal changes and a lot of changes on the back end with communicating to Surescripts. And really quickly, just want to hit on a couple bug fixes that I know have been some thorns in provider side. So we've had an issue in production where sometimes when you're selecting a pharmacy via pharmacy search, you get like a star or an error over and over again. We have fixed that. So as you're selecting pharmacies and going from patient to patient, you shouldn't have any of those issues anymore. We also had an issue where if you were trying to prescribe gabapentin and you were crossing borders, so maybe you're a provider in Virginia and you were sending to a Maryland pharmacy, gabapentin, that specific drug, often has a different DEA schedule depending upon the state you're in, and we weren't properly obtaining that different schedule, and so it was popping up a can't find DEA schedule alert. We have now fixed this. So when we send controlled substance prescriptions, we will now be finding the DEA schedule for both the providers state as well as the pharmacy state, and then we will set the prescriptions DEA schedule to be the most stringent one. So if one was a Schedule 2 and one was a Schedule 3, we would pick it to a Schedule 2, whichever is the more severe schedule. All right, so the next thing I want to talk about are pharmacy fill messages. This is a new message that you can receive, and you will see this in the history screen. So when I go to the history screen, we now have this e-status field, and this now displays a lot more information than it used to. But if you have the fill service level turned on and your pharmacy supports these types of messages, they can now display as they're dispensing or maybe putting back to stock prescriptions that patients are receiving. So this might be helpful for you to discern whether patients are actually in fact getting their prescriptions or not, and you can view that information here in the e-status. You can also, with a drug, click on this e-status field, and what this will do is it will walk you through the different messages that we've received for that prescription and give you information on all of them. So this will really kind of take you through what's going on with this prescription, and you again could see those fill messages come in as they would month to month. If you're interested in receiving fill information, this is a new service level. Please reach out to our support team, support@isalishealthcare.com, and they can work with you to get your providers all updated with that service level. Another new message that I want to show you while we're here in the medication history is the ability to cancel a prescription. So let's say we have this BD syringe and whoops, we didn't mean to send that, or maybe the patient's been on it a couple of months and you need to change the SIG or change the dosage of that prescription. So you want to cancel all future fills. What you'll do to cancel it is just, again, click on this e-status here in the med history for the specific drug you wish to cancel. We'll then click on the new RX and then come here to our cancel button. And then you can select whether you're canceling or discontinue. Again, cancel would be like, oops, I didn't mean to send this. Discontinue would be, please stop all future fills. This will send a message to the pharmacy. It's also going to change the status of that drug to stopped, and then the pharmacy will respond. And you'll see in the e-status what their response was. They could example responses would be that all future fills were canceled. They could say we've filled all of the fills, so there's nothing for us to do. They might also say that we transferred this to another pharmacy. We don't have it on file anymore. Again, cancel is a new service level. So just like the pharmacy fill messages, if you wish to send those new messages, please reach out to our support staff. All right, now that we've talked about new RX updates, the new fill messages and cancel medications, I want to go to our task prescription screen. So this is probably a screen near and dear to a lot of your hearts. And this is the screen that the pharmacies are going to send you all of their refill requests for. Also, if you are receiving refill requests from MML or My Medical Locker, that's where these will continue to come in. So the first thing I want to talk about is some pre and post release action items for all of our users of this screen. So before the release, we need to make sure that all of your refill requests are responded to. Any refill requests that are left out in the queue prior to our release, or when we take the system down Saturday morning, they will be put in the completed change request queue. That's because we are updating the backend script information and we won't be able to respond to them. If you have a refill request that comes in, right before the release, or maybe, a couple hours before the release, and you weren't able to respond to it, it's okay. Pharmacies are able to now send a follow-up request 48 hours after sending that initial refill request without a response. So if some refill requests do automatically get put in that completed change request that you need to respond to, don't panic. You should get a follow-up request within 48 hours of the initial request. Also, if you're maybe a provider who has a lot of refill requests out here that for whatever reason you just never responded to, this will kind of act like a clean slate for you. So it'll help you clean up your queue and kind of start from scratch. All right, so let's talk about what's changed with refills. There are quite a bit of changes. Post-release, when you come into this screen, there is an action item you will see out here under the prescription. It's going to show like a red gear icon until you come in here and set these settings. So when you first pop into the screen, it's actually going to pop up this assignment screen. And I want to walk you through kind of the logic for how you want to set this up. So you've got 3 sections to the screen. The first is the My Task Counts section here in the left-hand side. These settings are what's going to drive your counts here in the refills tab and then also in the prescriptions tab. So if you are a user who does not monitor the My Task Prescriptions refill tab, then it would be appropriate for you to come in here and say your task counts should be none. You would set it to none because you don't monitor this queue. If you are a user who triages unsolicited refill requests, these are requests that we are not automatically able to assign to a patient. You want to make sure you select this unsolicited checkbox. And again, what that will do is if we get unsolicited refills, it will show up in your task queue to work. If you are a user who gets refill requests assigned to you, either as a individual user, or a user group you are a part of, you want to make sure you check the My Assigned checkbox, and that will make sure that anything that has been assigned to you as a user or a user group you're in, they'll show in your task counts. Finally, we have this My Task Counts pending. So if you are a user that triages or assigns or even responds to refill requests on behalf of or as a provider, you'll want to click this pending checkbox. Okay, this will show any prescription refills that requests have not been assigned to a user or user group for a specific provider. Okay. The next thing you want to set up are your default prescribers. So over here on the right-hand side of the screen, you've got a list of default prescribers. These are the prescribers that you're working on behalf of. So this is going to drive what's in the pending and the completed refill request queue. So I have this set up currently as a solo provider, where the provider is working his or her own queue. So they would work the unsolicited and the pending queue. And I just have my provider. If you were like a nurse or an ancillary medical staff member, or maybe an admin who are triaging requests for multiple providers, you just need to come in here and select the appropriate provider locations you're triaging or responding to for. And the final thing we have in here is the update additional users. If you have multiple login IDs that you want to copy these settings for, or maybe you're an admin of a practice and multiple users should have the same settings, you can add user IDs in here separated by a comma, and then when you hit the save button, it's going to set the my task counts and default prescribers to those additional users. All right, so once you come in here and set this up, we're going to hit the save button. And I want to let you know that those settings can be changed as necessary. So if day to day, maybe you're an ancillary medical staff member or an admin at a practice, and you need to be triaging or responding to different providers' requests, then at the start of each day, you would just come in here to this menu right here and select assignment setup, and then that would allow you to select which providers you wish to see in your queue. So hopefully this additional flexibility will allow our practices to triage and respond to requests in a pretty timely fashion. All right, so I'm going to go to pending refill requests here. One other thing that I want to point out that we've added that's new for the refill request queue is the ability to reassign refill requests. So let's say you had assigned refill requests to a user and that user got sick, so you need to reassign them to another user, or you need to make that initial assignment. Then you can come in here to your queue, and let's say you're just trying to find all of Dr. Bertoli's requests, or you were trying to find all of them that were assigned to a specific user. You could type in Bertoli, and that's going to go out and pull up all my requests for Dr. Bertoli. And then what I'm going to do is come here back to my menu and say reassign. And then this would allow me to select a user. I can select Carly, or a user group that you want to assign those requests out to. So that's a new feature that we've added, and we hope that really helps some of our practices who are triaging these requests across users and user groups. When you're doing that reassignment, you have the ability to add an office memo to those requests if that's applicable. And then you could also use this feature to remove an assignment that would put those requests, it would take it out of the my assigned queue and put it back to your pending queue. So, all right, let's go ahead and take a peek at a refill and just walk through some of the changes within here. So we have a new response button that you may or may not be able to use, and that is the replace button. So in the past, you either had the approve or deny button. We now have approve, replace, and deny. The approve button is appropriate if you like the requested refill, and the only thing you'll be able to change if you hit the approve would be the number of refills. So maybe the pharmacy requested 1 refill and you might bump it up to 2, or maybe they requested 5 and you only want 1 because they need to come back for an appointment. So approve is you like the request and you may or may not want to change the number of refills that the pharmacy asked for. Replace is beneficial if you like the drug that they sent, but you need to make changes. So if you hit the replace button, what it will do is it'll actually bring up the requested medication on the pad, and then you can come in here and change anything about that drug outside of the provider and the pharmacy. So maybe you wanted to change the sig, maybe you wanted to take them from a 90 milligram, 400 milligram tablet down to a lower dosage. You could change that. Anything about the prescription you can change and then send, which is pretty cool. And then the final response, I want to cancel this. The final response that you have is deny. And you will use the denial button when you do not want to approve this refill request. When you hit the deny button, either a reason code or a comment is required to send off the denial. Another piece that I want to point out is that the replace button is used for our electronic prescriptions for controlled substances. So for instance, we've got a Suboxone generic drug here. If we wanted to approve this, we would have to hit the replace button. Again, it's going to load the prescription pad with the medication as it was sent from the pharmacy. You could then modify it if necessary, or if you like it, just hit the send button and that will send off that approval. While we're talking about controlled substance refills, I want to hit on a couple requirements here. So in order for you as a provider to respond to an EPCS renewal request, you both the provider and the pharmacy must be enabled for controlled substances. The pharmacy must also be on the latest script version. I don't think many pharmacies are still on the legacy script version, so that shouldn't be a big problem that we see in production. And then one more note, if the medication schedule is a 2, you are only allowed 1 refill. Another thing I want to point out is that for patients whose prescription refill request is for someone less than 19 years of age, just like the new prescriptions, they have to send a height and a weight. So you'll notice for Zachary here, we've got under the observation section a little note in red that it's required to have an observation. You'll just simply click on the edit button here. We're going to pop up a similar looking screen to the new RX screen. You'll have the option to select the height and weight that came in with the refill request. We're also going to show the most recent vital record we have on file for the patient. Or again, you can enter a new set of vitals if that's appropriate for you. But this is required to come in here and do. And also something to note, your ancillary medical staff, if they work or review your refill request, they will have the ability to come in here and save the observation and then assign this back to you as a provider without responding to it. So you can save that observation information without hitting the respond button. All right, so that covers the refill requests. Hopefully you already have this service level turned on in production. If you don't, please reach out to support at excelishealthcare.com. And again, they can help get this service level turned on for you as a prescriber. All right, the last piece I want to talk to you about today is the changes. So this is a new service level that we are supporting for Surescripts in production. And this is will hopefully allow our practices to streamline a lot of those calls or maybe faxes that you're getting from pharmacies with questions or changes that they're trying to make to your prescriptions that you've just prescribed, and really clean up that workflow for you. So this queue, again, like your refills, you'll want to come in here and you'll want to set up the assignment. For most of you, what you'll select is none because you don't have your change request turned on as a service level. Once you have worked with support and you've turned change requests on, that's when you'll want to come in here and, again, similar to refills, set up your task counts and your default prescribers for the change request tab. This can be different, so you could work refills for a different set of providers as change requests. We're assuming it'll probably be the same, but you do have the ability to set these up independently of each other. And then what you'll do is you're going to come in here and work your change requests. We're not going to go too deep into these, but I just wanted to give you an idea of what you might see in here. So you can get change requests from pharmacies for a generic substitution, therapeutic substitutions, maybe your prescription, the medication's out of stock. They have a script clarification they need you to make. There's a drug use evaluation type. They might need a prior authorization from you. And then the last type is a prescriber authorization request, where maybe they need to verify your DEA number or your AD number, anything to make sure they might need to get authorized from you before they can fill the script. So a prior authorization, it's going to be pretty simple, straightforward. You're going to see what you prescribed, and then you can either say, yeah, obtain that prior auth and hit the approve button, and then just come in here and enter your code that you obtained from the pharmacy and send it off. Or if you're not willing to get that for them, you could hit the deny button and send a different medication over that maybe doesn't need prior auth. If we were to get a therapeutic interchange change request, then it's going to look like this. And we're going to show you what was prescribed and then what was requested. You'll notice we've got things that are highlighted in yellow. Those are things that are different from each other. So that's showing you what's different from what you prescribed versus what they're requesting from you. Another thing I want to point out is they can send one-to-many drugs. So you'll notice the pharmacy's got 9 different drugs that they are kind of options, if you will, that you can come through here and figure out which option you like best. And then what you need to do when you respond is just make sure you're on the option you like. And then similar to refills, if you like it how they sent it, you hit the approve button. If you want to make changes, maybe you liked this lisinopril 10 milligram, but you want to change the SIG, or you only want to give them 30 tablets to try, then you could hit the replace button. Again, that's going to pop up the prescription pad with this lisinopril 10 milligram tablet. You can change whatever you need to other than the prescriber and pharmacy and send that off to the pharmacy. Also similar to refill requests, if this change request was for a controlled substance medication, then again, the approve button would not be available. You would have to hit the replace button so that you can go through your 2-factor authentication and send off that prescription to the pharmacy. Again, if you are interested in taking advantage of the change request, then please contact support to enable that service level for your prescribers. So there you have it. A couple things I want to point out. We do have all of this formally documented in our knowledge base, and as well as a checklist for pre and post release. So please make sure your staff is familiar. They've watched this webinar, they've reviewed our release notes and gone through that pre and post release checklist. And that will ensure that your office is prepared for a successful release on January 22nd. We thank you for your time, and we are excited to release all of these updates to you here in just a few weeks.